Mythbusters in rhinoplasty. In this video, let's go over some of the most common myths related to rhinoplasty. Myth number 1. Who exactly does a rhinoplasty? Is it an ENT surgeon or is it a plastic surgeon? Well, ENT is a field which encompasses not only the nose but also the ears and the throat. And plastic surgery is a field which encompasses the aesthetics of the entire body and not just the nose. The nose and rhinoplasty is one surgery which is common in both these fields. Now, rhinoplasty is a very tricky surgery because it involves the functionality of the nose and the external appearance of the nose. The external appearance of the nose involves the outside as well as the inner structure of the nose, which forms the basis of the external appearance. So, any surgeon, be it an ENT surgeon or a plastic surgeon, who's able to handle the functionality, the structure and the external appearance of the nose is a good rhinoplasty surgeon. And it really doesn't matter if this person is an ENT surgeon or a plastic surgeon. Myth number 2. You're going to get a one-time perfect nose after a one-time surgery. Well, that depends entirely on your expectations. If you have unrealistic expectations, then maybe not. But as long as your expectations are realistic, you've spoken to your doctor and your doctor is sure of what he can give you, and you know that and you want that, then I'm sure it's going to be a one-time perfect job. Also remember that the nose changes, just like the face changes and appearances change after, as you age, the nose also changes with the face. So your nose is not going to be the way it is when you are 18 years old, when you grow up to be 65. Similarly, even after a surgery, the nose does not stay as it is. The nose heals, the nose changes in shape, things happen. So you cannot expect that particular result to stay forever and ever because of the natural changes which take place in the nose. Myth number 3 and myth number 4. Myth number 3 is your nose is going to look unnatural. And myth number 4 is you can tell if someone has had a rhinoplasty. Well, I'm putting these two together because the answer is the exact same. In the nasal surgeries, in rhinoplasties, what we do is we take a part of the body itself, like the cartilage of the nose, and we reshape it to form the structure of the external nose. We may also use ear cartilage, we may also use rib cartilage. But basic point is that we don't use any external material as such. We use parts of the body itself to reshape the nose. So it is not unnatural per se because of that reason. And will you be able to tell if someone has had a rhinoplasty? Most likely not, unless you've driven that person for the surgery or you live with that person day in and day out. You cannot tell if a person has had a rhinoplasty or not. If you're meeting someone for the first time, absolutely not. Even we as rhinoplasty surgeons have a little bit of a difficulty figuring out if a person has been operated in the past or not unless we examine the patient very properly. Okay, that gets us to myth number 5. There is one perfect nose. Well, there is one perfect nose for every face, but there is no one universal perfect nose. Every face is different in shape and size. And so, every nose has to be different in shape and size in order to fit that face perfectly. There is an actual measurement method by which you can measure the shape of your nose and the size of your nose based on the shape and size of your face. I have covered this very well in my previous videos, so you can refer to that if you want to know. Myth number 6 is I will look like a Hollywood celebrity after the surgery. Well, let's just hypothetically imagine we can transplant the nose of a Hollywood celebrity on another person. Well, that person does look different, but not like the Hollywood celebrity. So you will end up looking different, but certainly not like a Hollywood celebrity. The reason being, the face has other aspects to it also, like the lips, the mouth, the chin, the structure of the face, the eyes, the forehead, everything. So those things are not changing, and the nose has a certain role to play in it, but not the only role to play in it. So no, you cannot possibly look like a Hollywood celebrity. And myth number 7, which is just a contrast to this, and that is changing the shape of my nose won't make a difference. There are so many Hollywood celebrities, Bollywood celebrities who've gone under the knife just for a rhinoplasty. And yeah, they do look better after their surgery is complete. So yes, you will look better most likely. And it's not just celebrities, it's even normal people who can undergo a rhinoplasty and look better than what they used to when they began. Okay, myth number 8, there will be a scar. To understand this, you need to know that there are two types of rhinoplasties, the open rhinoplasty and the closed rhinoplasty. When the closed rhinoplasty is done entirely from inside the nose, from inside the nostrils, so there is no question of a scar. However, the open rhinoplasty is done with a small bit of a cut just behind the tip of the nose. And so yeah, that does leave a small minuscule scar. But no, that scar is not seen very easily unless someone turns like this, looks from under your nose and looks with a magnifying glass. But if you want to know if you're going to get this scar or not, you need to ask your doctor before the surgery whether or not you're undergoing an open rhinoplasty or a closed rhinoplasty. And finally, myth number 9. Will I ever outgrow this dislike of my nose? Well, the answer to this is very, very tricky, and I cannot give you a yes and no answer for it at all. Because it depends on the phase in life which you are. It actually depends on what you're thinking. Imagine if you're in a state where you've just recently had a breakup, or you've just failed in an exam, or you're really stressed out at work, or you're depressed in general. In such a situation, it's very likely when you get out of this depression, you will start liking your nose, you will get used to it, and you will be absolutely fine. But imagine you're in a state where you're absolutely fine otherwise, you're happy in life, and you feel that a change in shape of nose will make you look better. And it's not just you, it's your loved ones also who agree with you. When you have your family support also, well, there is a very high chance that you will benefit from a rhinoplasty and you will not really get over this dislike for your nose. So, this is a very personal matter and you need to really discuss this with your rhinoplasty surgeon before you go under the knife. That was all for this video. For more such videos and ENT related content, please log into my website www.entonline.in.